Millions of people take aspirin daily to prevent heart disease and stroke. But now the advice around popping that pill may be shifting. Joining me now live over Zoom to talk about the new recommendations and what they mean for you is AHN cardiologist Dr. Raghu Tadikamala. Thank you so much for joining us tonight, doctor.
Hi, Megan. It's my pleasure.
So I wanted to first set the table with who were these health recommendations meant for when it came to taking a daily low-dose aspirin?
So this is primary prevention. So this is for people who have not had an event. So they've not had a heart attack, they've not had a stroke, they've not had a bypass surgery or a stent put in one of their heart arteries.
Okay. Why did the advice change, or why is it possibly going to change?
So there's been subtle changes over the years in how we've recommended aspirin, noting that it's a medicine that has both risks and benefits. There was a big study that was done a few years ago showing that the benefits probably aren't as great as we used to think they were, and that the risks that we do associate with it, specifically bleeding, are real.
How significant are these risks?
So it's not dramatic. So in the study that was quoted, it's a big study, about 20,000 patients. So a really well done study, randomized, controlled. Half the study got aspirin, half the study got placebo or a sugar pill. And the bleeding risk is not huge. Maybe about 1 in 100 people in the aspirin group would have had a bleeding that wouldn't have had it in the placebo group.
Okay. Who are these people that are tweaking the guidance that impacts regular people's health?
So this is the United States Preventative Services Task Force. So it's a task force that's convened by an agency of the United States government that was authorized by Congress. But it's made up of physicians, public health professionals, basically experts in the field. And they talk about not just heart disease, but they talk about cancer and other diseases that they want to prevent. And they come out with recommendations from time to time and update those recommendations based on new evidence.
Does age play a factor in the guidance here, and if it is still okay to continue taking low-dose aspirin?
Yeah, absolutely. So I think one of the biggest changes in the guidance is for patients over the age of 60, or in this case, people over the age of 60, where they basically kind of recommend that aspirin should not be used as primary prevention in most cases. So in patients that are maybe very high risk, they would want to talk to their doctors about it. So patients maybe who smoke, who have diabetes, who have uncontrolled blood pressure, uncontrolled cholesterol, that would be considered. But certainly for routine use, they kind of recommend against it in patients over the age of 60.
And I'm sure there are some people at home wondering, well, what about people who've already had a heart attack or a stroke?
Yeah, certainly. So those patients are a completely different ballgame. That's a secondary prevention. Almost all of those patients we generally have on aspirin because they're higher risk. They're more likely to reap the benefits of aspirin while still having only a lower risk of adverse effects.
Dr. Tadikamala, thank you so much for your insight tonight and for sharing this update.